Hello, I'm Lori Ezell. I'm a member of the Spring 2016 RN Refresher Program at Anne Arundel Community College. I am a registered nurse, and I'm here today to demonstrate my head-to-toe assessment skills for a patient. So let's get started. First thing I'm going to do is make sure that I clean my hands and introduce myself to my patient. Hi there, I'm Lori Ezell. I'm going to be your nurse this evening. I was wondering if you could please tell me your name. Okay, Mary Jones, great. And Mary, do you know where you are? Okay, great. You're at Anne Arundel Medical Center. And why are you here? Okay, you're going to have your gallbladder out. That's a cholecystectomy. Well, Mary, in preparation for your surgery tomorrow, I'm going to do a head-to-toe assessment, just basically starting with the top of your head and ending with your feet. Just want to make sure that we're good to go for your surgery tomorrow. Now I've cleaned my hands, and what I'm going to do is I am going to start my assessment by looking at your eyes. I'm going to shine this light into your pupils just to make sure they're equal and reacting to light, which they are. And then I'm going to look up your nose just to make sure the tissues are nice and pink and moist and perfusing, and they are. Can you just say ah so that it can take a look in your mouth, take a look at your palate. Can you stick out your tongue for me? Okay, great. Everything looks good and pink and normal. The next thing I'm going to do is I'm just going to palpate your lymph nodes just to make sure that those are in good shape. Do you have any trouble swallowing? Any throat pain? Okay, none. That's great. That's wonderful going into surgery especially. Okay, while we're still at the throat area, I'm just going to listen to your trachea. Make sure that your windpipe is working the way that it should, especially going into surgery. Just take some deep breaths, please. Okay, great. Now I'm going to just listen to the apices of your lungs, which are the tops of your lungs. Just take some nice deep breaths, please. Okay, great. So to your right side. Okay, wonderful. Next thing I'm going to do while we're listening to your lungs is I'm going to listen to the various quadrants on your chest. I'm going to start with your right upper lobe, and your left upper lobe. Just take some deep breaths. Right mid lobe. You have 3 lobes on the right side. Left lower lobe. Just take deep breaths. And then the right lower lobe. Just deep breaths. Just breathe normally. Okay, while we're listening to your lungs, I'm just going to listen to the posterior of your lungs, basically listen on your back. I'm just going to take a listen here, just breathe normally. Okay, both upper lobes. Okay, great. I don't hear any kind of pleural issues. Do you have any trouble breathing? Okay, great. Nope, no trouble. Wonderful. Okay, I'm going to turn you back on your back. And now I'm going to listen to your bowel sounds. What we're going to do is make an imaginary tic-tac-toe quadrant on your belly. And I'm going to start with your right upper quadrant. Just stay quiet, if you will. Have you had anything to eat today? Okay, at breakfast. And of course, you can't have anything after midnight tonight, so we'll be putting signs up for that to remind you. Heading into surgery, that's important. Okay, right lower quadrant. Hearing some activity down there. Everything sounds normal. Do you have any abdominal pain? Have you had a BM? Okay, good. And you'll also have a fleet enema later in time for your surgery. I'll be doing that tonight. Okay, great. Everything sounds normal. Now, the next thing I'm going to do is I'm just going to palpate your pulses. I'm going to start with your carotid pulse. Okay, great. And we'll move down to your brachial pulse, which is basically in the crook of your arm. And then your radial pulses, which are typically taken at the wrist. Anytime you've ever had your pulse taken, you probably know where the radial pulse is. Okay, and then I'm just going to feel for your femoral pulses. Okay, great. And then I'm going to feel for your popliteal behind your knees. Good, strong pulses. That's what we like. Perfect patient. And then I'm going to palpate your pedal pulses. Okay, great. The next thing I'm going to do is I'm just going to listen to your apical pulse, and we measure your apical pulse 5 intercostal spaces down midline to your left clavicle. And that's basically where most of the time somebody like me or a physician would listen to your heart. So I'm going to find midline to your clavicle, count 5 intercostal spaces down. Okay, great. Sounds completely normal. I don't hear any unusual heart sounds, so that's perfect. Okay, now before we conclude my assessment, what I'd like to do is just take a look at your skin and evaluate something called skin turgor. And skin turgor is a measurement of how hydrated you are. And basically we pinch up a small amount of skin. It can be on your abdomen like I'm doing, or elsewhere on the inside of your arms, sometimes on the top of your hand. And everything is just bouncing right back into place. Of course, we started an IV on you, and that helps with hydration. I just want to make sure that I'm going to just pinch the tops of your hands. Everything is springing right back into place. And just check your feet. Okay, I think we've done just about everything. The last thing that I would like to do is assess your strength, and I'm going to ask you to pull hard on my hands, grip them hard and pull, pull, pull. Okay, great. And then I'm going to push against your hands, push, push, push hard. Excellent, excellent. I'm going to do the same thing for your feet. If you can just press against my hands, hard, 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 the hardest you can. Okay, excellent. Well, Mary, I would say that you're good to go for surgery. Of course, I'm going to be here all evening on the shift. If there's anything at all that you need, please don't hesitate to contact me. You've got your call bell, and it will be my pleasure to visit you throughout the shift. Thanks so much for letting me do my head-to-toe assessment.